All right, so just to let you know, it looks like quite a few of you are really familiar with the chat function, which is awesome. I can see all the comments coming through. When you use the chat function, everyone can see what you're popping in there. So throughout the webinar, feel free to pop questions in there, particularly, you know, if you want the opinion of maybe other consultants on the line. You may also have available to you a Q&A function, which is separate to the chat. And I believe with the Q&A function, that question will only come to me as opposed to everyone being able to see it. Okay, so I'm looking to hopefully have a bit of time at the end to answer any questions that come through. And I'm certainly happy to leave the chat open at the conclusion of the webinar as well, in case anyone on the line would also like to discuss anything amongst each other. All righty. So I'm gonna make a start. My name's Sarah. Some of you may have already met me or know of me. I'm the Back2Work New South Wales State Manager. So I'll be giving the webinar today. All righty. If I can get it onto the next slide. Bear with me. Of course it worked when I tested it 20 minutes ago. Sorry guys, just give me 30 seconds to figure out why it won't go to the next slide. Okay, you may only be able to see me at the minute. Just bear with me. Just trying to figure out how to get these slides working. Okay. Okay. I know it's not on the maximum view here, but I might just have to do it in this fashion. All right, can people see the slide okay? If I do it like this? I can't even see your guys' chat. Okay. Hoping that you guys can see the screen, and I'm gonna go ahead because it's now 5 past, and it appears that my screen is sharing. Okay. So last week, if you attended last week's webinar, you would have learned about building rapport and goal setting over video and telephone call. Okay, hope you enjoyed that webinar. It's one of a series of 6, as you know, that Back2Work is providing weekly. So what are we going to be covering today? So today we're going to be talking about assessing job seekers. All right. Essentially, we wanted this to be really useful for a range of experience levels within, I guess, employment services or within industries where you are working with job seekers, in the sense that we hope it provides lots of useful tips around, or for perhaps those who are a little bit new to the industry, and acts as a really nice refresher for those of you who perhaps have been in the industry for some time. So a quick overview of the sections that we'll cover. Section 1, assessing available information. Section 2, assessing existing clients. Okay, so this isn't only referring to clients that you're seeing for the first time and making an assessment based on that. It's also this idea of ongoing assessment for those clients that may be on your caseload for a period of time. Section 3, conducting the assessment itself. What kinds of things are you doing during that appointment with the job seeker? What should you be thinking about? And section 4, just a quick overview of some tips on running successful appointments. All righty. Okay. So what information might be useful for us? So for those of you who are employment advisors or employment consultants and are sort of attached to employment service providers, you'll have access to what I'm sure you're all familiar with, the ESAT, or Employment Services Assessment, which is an assessment carried out by Centrelink. So this gives us a really good overview of any barriers that have been documented. They could be mental health barriers, physical barriers, other medical barriers. And of course, in addition, the ESAT might even comment around education, employment history, in some cases legal history, or even transport or accommodation issues. So right off the bat, if there's an ESAT, it's always a good idea to go through that and familiarise yourself with that information. Okay. We've also got benchmark hours or reduced work capacities, and that can be quite telling. So if you've got someone who's on a 15-hour work capacity, you might think right away, are they a parent? Are they over 60? Is it that they've got barriers which mean they might not be able to work full-time? Have they had multiple reduced work capacities in the past? Okay, so is there something enduring going on? Or what's happening to keep reinstating this reduction in work hours? We've also got streams in Job Active, or different levels if you're a DES consultant, which can elucidate how much support people might be needing. And that can kind of give us a little bit more information on perhaps the severity or complexity of the barriers. Period of unemployment. Very telling, okay? Have you got someone who's been sitting on the caseload for 52 weeks or more, for example? And if so, what stream are they in? What are their benchmark hours? If they've been sitting on the caseload for 52 weeks and they're in stream A or B, that might prompt you to say, oh, this doesn't look quite right. I think this person needs to be reassessed. Something else to keep in mind with that also, guys, it's not just about the stint of unemployment, how long that period is. I would also be taking note of if they're falling out of work repeatedly. So we can find with some people, they actually get work quite easily, but it's just they're not able to sustain employment. And that's a little bit different to perhaps someone who has just not been employed for a really long time, okay? So is it that they're getting work repeatedly and dropping out? And if so, that begs a slightly different question. What's going on that they're dropping out? Is there something specifically that's happening at work, something that they're doing? Is it to do with just reliability issues and not showing up? So that can provide a little bit more information that might prompt you to have some further discussions around that with the job seeker. Okay. Also, take note of whether they've sort of jumped from provider to provider. Are they feeling unheard? Okay, or has something been missed along the way? So it's not just about having the information or even just reading it, but having an understanding of what that information might be telling you, or what you might want to explore further based on that information. Okay, it might also tell you what support they haven't had in the past, and might prompt you to think about, okay, well, what could we put into place now? Okay. So reassessing existing clients. So again, you can revisit all of that information that was on the previous slide, going back and reviewing the ESAT and reasons for reduced work capacities. But what you also want to do is think about the information that you've gathered just by a function of working with that person over time. What's worked in the past with them? What hasn't worked? Has there been any progression? When there was progression, what could you attribute that to? All of those little bits and pieces. And what we often find, and I'm sure many of you have heard this saying in different contexts, the best predictor of future behaviour is past behaviour. Okay, so always keep that in mind. All right, and what you're going to do essentially with the information that you've got, you're going to be able to form a bit of an opinion about the likelihood of future outcomes. All right, so thinking about the information you've got, thinking about the past behaviour that you're aware of. And I think a really good way of you conceptualising this is just using a really simple 10-point scale. Okay, what is the likelihood in your mind that this job seeker will be able to achieve a particular outcome? And if, say, 5 pops up for you, that's going to sort of really prompt you to think, okay, well, if I think that there's a 50-50 chance of this happening, or less than 50% chance, what could I maybe do differently, or what new things should I be thinking about? I wouldn't limit that just to yourselves either. I think that this can be something that's really useful, a useful exercise with the job seeker. Health professionals use this a lot. I appreciate it's not necessarily something that you have to do in the role, and that sometimes there are time limitations on what you can do. But I do find that you can get a lot of good information when you ask job seekers to sort of rate themselves. So, asking them, what do you think the likelihood of you being able to successfully complete this task by our next appointment is, on a scale of 1 to 10? And if they come back and say, oh, it's a 4, all right, that opens the field for you to say, okay, well, you're telling me it's a 4, so you're not feeling like, there's a good chance of you getting this done. What do you think would bump that 4 up to a 5 or a 6? And they may say, oh, I can't do the resume because my computer skills are crap, or something like that. And it may tease out some information that you didn't have previously. But more importantly, if it's something that can just be rectified, or some extra support that you can provide, and you can do that, that's going to increase their chances of then going away and being able to achieve that outcome. So scales can be a really useful tool. Okay, my chat function has just started working again, which is great. So feel free to be using that or sending me Q&As. All righty. Okay, apologies. Conducting the assessment. All right. Part of this encompasses just being comfortable sometimes with talking about difficult topics. All right. It is not necessarily, or I think in most circumstances, it's not going to be appropriate for you to be addressing certain barriers with your job seekers simply because they lie outside of the scope of your role. But I'm sure that everyone on the line has had an experience where a job seeker has disclosed something that might be sensitive or distressing. So it's probably happened to everyone in the past. It will certainly happen again. And I think it happens quite frequently, all right? And that could include things like the job seeker reporting domestic violence or past trauma, substance use, whatever it might be, a number of different barriers. So not able to directly address that barrier, there are some things that you can be doing to ensure that you're solidifying rapport between yourself and the job seeker, and that you're able to link them in with the necessary supports. Okay, so for example, engaging in active listening and reflecting on what the person has said. So that can really ensure that the person feels as though they're being heard, and it will really help build the professional relationship between yourself and the job seeker. So what's active listening? That could include, for example, some nods, all right, making sure that you're making eye contact, being aware of your body language. Again, under time limitations and maybe having to do lots of appointments in one day, get caught up with the note-taking on the computer or admin and not realise that we're facing the computer as opposed to gearing our body toward the job seeker. We might not realise that we're not making a lot of eye contact. All right, don't sit with your arms crossed, because that usually indicates that you're quite closed off. So just being aware of body language, and even just little verbal gestures like, oh, okay, I see, or yep, just something to acknowledge that you're listening. So that can be really useful and easy to apply. Reflecting, statements like, it sounds like you find it hard to get motivated sometimes. Is that right? So check in with them, make sure you're understanding what they're saying, and allow them some time, allow them the opportunity rather to give you a bit of feedback. And they'll say, yeah, that's exactly right. Or no, that's not quite what I meant. This is what I meant. All right. So making sure that you've got that good, clear communication. Also, of course, showing empathy is really important. And that is usually, the best predictor of the rapport that you'll build with your job seeker. Okay. So things like, it sounds like that was a really hard experience for you. That acknowledgement that they've been through something difficult. Also be aware, it can be really useful to use the same language that they use. So if they've said it was really hard or it was crap, use that same language back to them. Oh, I hear you saying that was just a really crappy time and that must have been really hard. Thank you for sharing that with me. Or could you tell me a little bit more about how that's, impacted work, something like that. All right. So just be aware to try and use their language where you can as well. And of course, offer support. So when I say offer support, again, this would only be within the scope of your role. Be aware of your local, community services. Do you have the contact for your nearest GP, your nearest bulk billing GP? Are you aware of maybe some mental health supports close by? Do you know the nearest hospital? Do you have the mental health line on your desk? That's a really useful one. Or perhaps, the lifeline number if you want to provide the job seeker with that. So having these resources on hand in your drawer or on your desk is really, really useful. So where you do need to link them in with outside support, you have that ability. For some of you, if you've got Back2Work on site, that could be another option for support. Okay. All right. Conducting the assessment continued. What other questions could you be asking? Okay. In terms of their barriers, how does it impact work specifically? Does it impact work? Not all barriers necessarily do, or that person might actually already have some really good management techniques in place. So for example, I have worked with a job seeker in the past who had a very significant spinal injury. Sorry, I'm just trying to check my chat because I can see someone's putting a question through. Excellent. Thank you, Johnny. Johnny's made the suggestion of working with your team to build a service directory, which is a really good idea. And I've seen quite a few workplaces adopt that. So just having something with all the information on services in the area. Thanks, Johnny. Appreciate it. So yeah, sorry, I've worked with a job seeker in the past, significant spinal injury. At that time, most of the people who had been sort of supporting him and worked with him assumed that he couldn't continue in the previous industry he was in, which was sitting at a desk, working on a computer, office admin, which he had done all of his life prior to sustaining this pretty severe injury. But he could, and it was just a matter of him being able to stand up at his desk rather than sit down. Okay, so we need to get into the nitty-gritty of these questions. What supports are there in place right now, if any? What other supports might be available to them? Okay, and again, where possible, you might want to introduce that 1 to 10 point scale. Just ask the job seeker. This is a tool that we use in Back2Work and lots of health professionals use, for example. You know, how confident are you feeling about getting back into work, say, in the next 8 weeks? Okay. And if they say, you know, 6, again, opens up the floor for you to then say, okay, well, what do you think would get that 6 up to a 7 in terms of your confidence? And they might say, you know, whatever it is, I need more interview practice, or I need these supports in place when I'm at work. Okay, and allow them that time to come up themselves with, you know, what it is that would get that point, that 6 up to a 7 or an 8, for example. Okay. All righty. So those scales are a really good way to get the job seeker themselves to be coming up with those ideas and to really be telling you what they think they need. And the one thing I was going to add in there is don't feel uncomfortable to allow a bit of a pause when you're asking questions about scales or anything else, just to give them that time to come up with the answer on their own. I think sometimes when we kind of have an idea of the support someone needs, or maybe we're under a bit of pressure in terms of the time constraints in an appointment, and we can be really tempted to be offering all the solutions and doing all the problem solving. But that's not necessarily empowering or effective for the job seeker. So when you are sort of asking questions, just get comfortable with sitting back and allowing a few seconds of silence. Give them that time to think about it and to be coming up with solutions on their own. Okay, that's also going to encourage them to engage in that problem solving, you know, when they leave appointments and they're doing other things. Okay. At-risk clients. I'm not going to spend too much time on this today because I'm just very conscious that different workplaces might have different procedures in place, but I just wanted to raise a few important points because, you know, it's likely at some point you will be presented with an at-risk client, and it's always good to be confident in terms of knowing what to do. So if someone that you're working with expresses a desire to hurt themselves, hurt someone else, or end their life, it's really important that you know what steps to take to ensure that they are supported and that you're aware of your workplace risk management procedure. Okay, you need to be across that. So if you're not, it would be a good idea to have a chat to your team leader or your manager and make sure you're comfortable with the procedure that's in place and you know what you need to do. Okay. Are you comfortable with the questions to ask? All right. You don't want to be in a situation where you've had an appointment with a job seeker, you've been a little bit, you know, you've been worried about their mood and some of the things they've said. So there's been some concern, but you weren't really comfortable about probing around risk. So they've left the appointment and then you feel really uncomfortable afterwards because you think, oh, I think they might be at risk. I'm not comfortable with this. And then they've left. So just be aware of the kinds of questions that you can ask, practice it, and just be comfortable with it. Okay. Again, as I mentioned earlier, know the local community mental health supports, and importantly, know some of the local GPs in the area. And I'd advise that you'd know the ones that bulk bill, because a lot of the clients that people on the line will be working with may not be able to afford the out of pocket. Okay, so always good to know, do a quick Google search in the area, who bulk bills, who's had good reviews that bulk bills. GPs are fantastic because they are a massive referral source. If you send someone to a GP, they can get a referral to a psychologist or, you know, other health professionals that they may need. Again, know the local hospital. Perhaps even have the number of the mental health care team that's attached to that hospital. Okay, really important. Also, if it's a phone call with the job seeker, which at this point is likely, very likely the case for everyone, you know, have a think about the kind of information you might need to get from someone over the phone. Keep in mind, you don't have the same cues over the phone as you do face to face. You can't see their body language. You can't see their gestures. All right. A lot of how we communicate is non-verbal. And when we're on the phone, that can be taken away. And you're really relying on exactly what they say or their tone. Okay. So if you are talking to someone on the phone and you're a little bit worried about risk, you know, ask them where they are. Are they at home? Are they elsewhere? Just in case, you know, you do need to call an ambulance, for example. Ask them if anyone's with them. Do you have anyone there with you for support? And if they say no, is there someone that, you know, that we could call to come and spend time with you today and offer that support? All right, so just make sure you've got that information. But again, please check in with your specific workplace around that risk management procedure. Okay. All right. Okay, guys, only sort of 3 slides left, so another 2 after this, because I'm just conscious of the time and that people might need to get back to work. So I'll try and speed through it just a little bit. Setting expectations, really important. Collaborate with the person on a plan of action. Depending on what industry you're in, because I know there might be a bit of varied industries of people on the line. That could be in the form of a job plan. If you're with an employment service provider, could be a contract of some other sort. But having that in place, a bit of, I guess, a contractual agreement, if you like, is a good way to set some clear expectations with the job seeker, right? Go over those expectations with them. Make sure that they have a clear understanding of what you expect of them. Right? It's much better to have this done up front, and that way there can be no surprises for them later down the track. So if a month later you say, oh, you were supposed to do this, and they say, oh, I didn't know that, and that's going to sort of possibly, you know, negatively impact rapport. Right, so you're going to have a stronger relationship if you just set those expectations up front. Okay. Also, by discussing them collaboratively with the person, it can be a way to highlight to you any potential compliance or reliability issues. Right? See how they're responding to the expectations you're setting. Calendar management. This is, I guess, just something to help you in terms of your day-to-day, and I think overall really does help with self-care. Give yourself enough time with the job seeker or with your client. All right. I know that a lot of people on the line are under time pressure. You're perhaps having to do lots of appointments in one day, or given small slots for appointments. But just be wary, is it the first time you're meeting them? And if so, allow yourself that time to ask the important questions and cover off those key things that you want to get done. All right. So to the best of your ability, set aside at least an adequate amount of time. Allow some time either between appointments at the end of the day, just to wrap up any admin, make sure your file notes are done, and potentially do some planning for the next day. All right, so you're not feeling like, disorganized or flustered. If you can, and I know some providers do this already, run some groups for job seekers, okay? Be mindful of how you're putting people into groups. You'd want people of perhaps similar presentations or maybe similar levels of work readiness, for example. But it'll show them that they're not alone if they're able to interact with peers, and will offer some peer-to-peer support, okay? It also allows you to save time by servicing multiple clients. But that will really depend on the job seeker and, what information needs to be conveyed in the group, but it's an option. All right, setting goals and just a little bit more around session planning. So guys, this is the last slide. Set really clear goals. And this is really in line with setting the expectations, I suppose. This will really help you track of what's successful in the appointments and what you're doing that's really successful and helpful. And it will help the job seeker track their progress as well. Right? By setting some really clear, realistic and achievable goals, I just want to reiterate that. We don't want to be setting the job seeker up for failure. We want to make sure it's stuff that they can do. So then once you're able to actually tick it off, the job seeker feels a sense of empowerment and achievement. And that's really important because you want them to build that confidence so that they're not continuously relying on you, okay? So that they can go away and outside of appointments, successfully do their job search or have a bit of a go of working on their resume, all right? So it's really, really, it's a useful tool to be able to say to the job seeker, oh yes, we've achieved this goal that we set. Tick, well done, give them lots of praise. Set a rough session plan for yourself. Provide structure. And again, if you are limited for time, having a plan is really going to help. So, have the key things that you want to cover off in that session. And there's always going to be instances where the person may go off on tangents a little bit, and that's okay, especially if they're talking about something that's distressing. Engage in that active listening, reflect, and then draw it back in, okay? I'm just really conscious that we only have limited time together, and I really want to check off this, this goal that we've set. So, let's come back in and talk about this. And if you'd like to talk about this other issue further, I'm going to pop it in as an agenda item for next week. Okay. So make sure that you're comfortable with creating those boundaries as well. In terms of appointments on track. If you build a good rapport with the job seeker, they're not going to be fazed by that, I promise you. As long as you've got that strong professional relationship and you've built up the rapport earlier on, they'll have no issues with you, acknowledging what they've said, but pulling it back into the agenda that you've set. Review your session plan regularly and make sure that you are addressing those work-related barriers. Okay. There's a little bit of an example on the other side of this slide of how you could set some agenda items. Certainly not telling you how to run your appointments. You may not necessarily have time to work on these particular things. It's just a bit of an example. If the barriers are interview skills, and maybe poor communication and need an updated resume, set a bit of a plan for the next few sessions and some goals and expectations. Session 1, we're going to have a look at the resume. I've said set homework. I don't like the word homework. I'm going to have to change that. I don't think a job seeker would like the word homework. So maybe phrase it as a between appointment task or between session goal or something like that. You might want to work on, how to communicate with employers in the next session, give them some tips. In another session, plan to go through some commonly asked interview questions or something like that. So that's just a bit of an example, all right, of how you might want to set a bit of a plan for sessions. So guys, that brings me to the conclusion of the tips that I hope were useful in terms of assessing job seekers that may be new or that may be existing clients. Apologies if I sped through that a little bit. Thank you so much for listening. I really appreciate it. The next session will be on self-care and resilience, so please join us again. That won't be run by myself, but there'll be someone else on the line for that one. And what I'm going to do now is I'm going to stop sharing my screen so that I can properly see the chat. And if anyone has any questions or wants to have a chat about anything, we can do that. Thank you again, everyone, for attending and for listening and for your attention. Really appreciate it.